right?
Right.
So why meat specifically? I don't know whether Dr. Commeh would want to. Why meat? Is it why are we hoping to get quite a good yield or dividend of benefits by targeting meat consumption? Maybe that's my question.
Dr. Commeh
Yeah.
start.
Okay, thank you very much,
Right.
Notice. So to add to the discussion, over the years, meat has been promoted as a good source of protein. People are encouraged to consume meat as a way of battling malnutrition, even increasing iron intake and all that.
Right.
So the conversation has not been on the negative effects of meat.
Essentially, we thought the more meat,
Exactly.
The better.
The better.
the better you are. In fact, you have arrived.
However, by consuming more meat.
Yeah, it's a status symbol.
Yeah.
It's absolutely a status symbol and translates into our culture even as well. In the home, traditionally, the more up there you are, the more meat you have on your food.
Very good.
The fathers are given some sort of prominence by having the biggest chunk of meat. So all these practices sort of elevate meat to a symbol status, to a healthy diet. However, consistently, research has shown that meat also has this other effect that is important to consider when you are having this kind of discussion at all.
Okay.
And I'm sure last week I was listening to you. We talked extensively about some of the effects that meat can have. But I don't think that the typical Ghanaian would appreciate that meat, for instance, could be associated with cancer.
Right.
I mean, you are talking cancer.
Okay.
And then you are talking about this supposedly good
source of
protein, and now you are saying that. So it's important that we continue with the awareness creation. It's important that we continue with the sensitization, and this sensitization is not just for the common man, even for policymakers at my level, for health implementers. Everybody needs to be sensitized on the potentially damaging effects, such that we don't continue to overdo it, and we don't give the impression that it's all good, because research has shown from cardiovascular diseases to diabetes to the gastritis to colon cancer, it has been shown to be associated with it.
Right.
And as we are developing and advancing and we are seeing more and more of the chronic diseases, we are dealing with risk factors.
Okay.
But we need to sensitize people that this other product that we are all hailing as being a good source of nutrient could also potentially lead you down this path.